everyone, my name is Nia. Today I want to share about the assisted bathing, which is under personal hygiene topics. So regarding this one, you're supposed to do routinely later on for your everyday jobs, because we need to assist the bathing of the resident every day to many residents. So you will have many chances to learn from practical jobs later on. But before we go into these practical jobs, there are things that you need to know. So today I would like to share about it. So before we go into the topics, maybe one of you can share what do you think, what are the important things when we give assisted bathing to the resident?
Ensure safety lah.
Safety, like for example, like what?
You just put the belt lang.
Belt, what belt? What belt?
What?
Trouser,
mean?
the pants belt. No,
No,
safety
belt.
belt.
Safety belt.
Okay, good. And then
Safety
maybe
belt.
Angel one. And then what do you think? What is important? Why we giving assisted bathing?
Sure have privacy.
Correct, privacy. And then the usually one.
Yeah, for the to make it sure that they are for the hygiene,
Okay.
for the itchy, all these things.
The skin condition, right?
Yeah,
Okay, thank you for your input. So I want to share the objectives of we are giving the resident assisted bathing. Is for all staff to promote cleanliness and maintain dignity of care to the residents. And then our responsibilities is to bathe and clean the resident properly and according to the protocol. Okay. So before we do the assisted bathing, these are the preparatory phase. It means we need to prepare before. So for the first thing, you may want to assess the resident prior you do the bathing. You want to check the patient whether he or she have the high body temperature, he feel lethargic, tired, sleepy or something, and you may assess all the skin condition of the residents, like at the back area, the skin fold, everything before the diaper area also, before you go shower you check. And then if he or she have the wound, you check also with before you do assisted bathing, it must be properly covered. Okay, before you do these things, you check the resident first, and then you also check if the resident have the tubes. For example, like the NGT tube or the catheter patient. So we might be very careful with this tube patient also. And then you prepare all the requisites, like the things you need to use during the assisted bathing. Like for example, the towel, toothbrush, the shower gel, everything you must get ready, all the requisites before you do the assisted bathing. And then you check the commode, whether it is well function properly, and then you check all four wheels can be locked. And the most important thing also, the safety belt, it must be properly tied, can be properly fasten the seat belt. And then the most important thing is the patient privacy. So you make sure all the windows are closed, the curtains are drawn, and then inside the room, also in the toilet, you must make sure the patient privacy is there. And then before you going to give the assisted bathing, you turn on the water heater first before you do bathing. So the temperature, you might not need to wait the temperature going to be too hot or too low. Okay, now we are going to the performance phase. So we are going to do the assisted bathing now. First, you must wear all the apron and then face mask, glove, and if needed, the footwear, everything you prepare yourself first. And then you do the 7-step of medical hand hygiene. And then you explain to the patient about the procedure. This one is important because if some of the patient we can communicate, but some cannot. But if the patient can communicate, you should explain to them. It's not only the assisted bathing, for all procedures, before we should explain to them what we are going to do, so that they know what we are going to do. Otherwise, they may feel scared or frightened. So this is very important for all our nurses. And then you ensure all the wheelchairs, the commode wheels are locked, and then you assist the resident transferring from the back to the commode. So this is another topic about transferring the patient, about the good body mechanism, so which I'm going to do the next training topics. And then you transfer the patient gently from back to the commode chair, and then you make the patient in correct and stable position, and then you make sure the seat belt is fastened, and then you make sure all wheels are locked. Okay, and then you make the patient foot stabilize on the footrest also. And then the privacy, you give make sure the privacy for the dignity of care for the resident. So you must cover the lower part of the body, the resident body, with towel, and the top clothes of the resident must undress inside the bathroom or toilet only. So which means you cannot undress at the bedside. Okay. And then you follow the steps according to the showering protocol, and you must at least spend 5 to 10 minutes for showering the residents. So you must memorize all this because later on I have quizzes for you which you need to answer. And then you turn on the water heater, you test the temperature of the water at your wrist or elbow, and the patient is well communicate. You can also ask the resident to test the temperature, whether he or she is can bear the temperature also. And then you assist and allow the patient to clean accordingly, like face, the hair, all the leg, foot, and the private area, especially the skin fold area like armpit, for female patient, the breast fold, the abdominal fold, groin area, and then gluteal area, the perineal area, everything must be properly cleaned. And then we encourage the resident to participate as much as possible, because we want them to participate all the activities as much as they can. We want to be participate them. Okay. And then you pay particular attention to the skin folds, because as we know, they are on diapers, pampers most of the time, so they may have rashes, and all the skin fold area, they may have some skin infection or rashes or maybe fungal anything. So we need to assess the skin fold of the resident very well. And then you assist to rinse off and dry the residents, and pay attention to the skin folds. And in assisted showering, the showering is important, but properly dry the patient is also very important, because later if you don't dry the patient the skin properly, later you will find the skin problems later on, because all the skin infection, the fungal, everything will start from there. So we make sure we properly rinse off and dry the patient carefully. Okay. And then you access all the resident's skin. Is there any skin tears, rashes, infection, anything? We assess. If we found something, we document it, and then we report to the supervisor. Okay. So you assist the patient to put on clothing and cover with towel before bringing out the patient. So the top dress must be dressed inside the bathroom, and then the lower part must cover with the towel. Okay. And then you transfer the resident back to the bed from the commode chair gently. And then you position the resident in comfortable position, and you don't forget to put up the backside rail to make sure the safety. And then you remove all your glasses, apron, and throw in the dustbin. And then you do the 7 steps of hand hygiene before moving to the another resident. Okay. So these are the tips for assisted showering. So you must shower the resident at least 5 minutes. So the protocol stated 5 to 10 minutes, but make sure at least 5 minutes you spend the time in assisted showering. And then you apply shampoo and rub the scalp for 20 seconds and rinse off. Rinse off means you must rinse very clean. You must not let the shampoo gel left in the scalp, because later they will get the scalp infection also. And then you apply the shower gel over the whole body, especially bilateral, armpit, groin, and private areas, so which are the skin folds also. And then the wheelchair or commode must lock at all time. for the safety when it is stationary. Whenever you rest the patient on the commode chair, you make sure all four wheels are locked properly. And then these are the cautions which we need to be cautious during the assisted showering. Please do not rush. So take your time. Do not rush the resident for showering, and take your time. And then you make sure the privacy. For the dignity of care, you make sure the resident have the full privacy, and the safety is very important also. So you make sure the patient safety also, and then you strictly follow the protocols. Okay. So now we are going to watch the short movies about assisted showering.
You can make bathing easier and safer for residents by remembering the 3 C's of safe
So
bathing.
3C: collect,
Collect,
concentrate, and communicate.
Concentrate and communicate.
There you collect first all the
Collect
things
all
you
the
need.
materials. Make sure you have everything you need in advance. Organize the soap, towel, bathrobe, and anything else you might need, so that each item is easily accessible when the resident is ready for it. Make sure that the water
So there you
temperature
can
is
see,
comfortable,
before you give
and that the
bathing, you
bathing
must
area
have the
is free of
temperature
hazards
before.
that may injure residents. Also, prepare everything the resident will need after bathing. Have powder, deodorant, and clothing laid out and ready for the resident. After everything is collected and organized, you're ready to begin. As soon as you start the bathing process, you must concentrate on the resident at all times. Never let a resident out of your sight while in the shower or bathtub. Be especially
Never out of the
attentive
sight
to
of the
residents who have a
residents.
history of falls. They are at a greater risk of hurting themselves during bathing. Make sure you have enough time to stay with a resident throughout the bathing process. A demented resident needs your full attention to ensure safe bathing. Finally, it is important to remember to communicate effectively with the resident and with your co-workers during bathing. Always speak to a demented resident in a calm, reassuring tone. Never hurry residents. This might make them upset and frightened. Always give simple, one-step instructions and use visual cues. Use gestures. Point to the towel or robe. And communicate with your co-workers at all times, so that assistance is available if you need help with the resident. Additionally, bathing is safer and easier if residents are calm and comfortable. Bathing residents at the same time each day helps to establish a daily routine. Find out residents' past habits and try to copy those habits as much as possible. If a resident was accustomed to bathing in the morning, try to work that into your daily routine. If a resident never took showers but always took baths, try to bathe the resident in a bathtub. Complete the bathing process in a warm, private area in respect for residents' modesty. Make sure you cover the resident with a towel or robe whenever possible. When bathing demented residents, remember the 3 C's of safe bathing. Collect, concentrate, and communicate. And try to keep residents calm and comfortable at all times.
I think it's important when you approach a patient that you let them know what you're going to be doing with them. If you approach a patient and you don't express what you're going to do with them, they tend to get resistant, or they're afraid that you're going to hurt them. And so it is important.
There are 5 steps for bathing residents safely and correctly. First, get everything you need to bathe the resident. This includes soap, towel, robe, and other things needed in the shower or bath. Don't forget the things you'll need after the resident finishes bathing. This includes a change of clothes, deodorant, and anything else the resident uses for grooming. Second, help the resident undress in a warm and private area.
Just sit in the chair every time I take the shoes and socks off.
Make sure you talk to the resident while you are helping.
Baby, I'm gonna take your shit out. Get a bath.
Give simple one-step instructions.
They don't even put your pants on there. Or your feet out.
For example, point to the robe and say, "Let's put this on you."
They don't stand up, put your robe on.
This way the resident won't become frightened or aggressive. It is important for the resident to remain calm and comfortable throughout the bathing process. Third, bring the resident into the bathing area. Check the water temperature and make sure it is not too hot or too cold. Let the resident feel the water before getting in.
Come on, see the water on. Yes. Come on.
This way the resident will know that the water is a comfortable temperature. Remember, it is always important to show and tell the resident what is going to happen before it happens. Fourth, help the resident start bathing. Pay attention to the resident at all times. Bathrooms are a common place for falls and serious injuries. The resident needs your help to stay safe. If the resident has forgotten how to bathe, you will need to help. Always respect the resident's modesty, but make sure every part of the body gets thoroughly cleaned. This is especially important for residents who have trouble controlling urination or bowel movements. Also, check the resident for bruises, injuries, or sores. Some demented residents are not able to report injuries or infections. Report any problems to your supervisor. Fifth, carefully assist the resident with drying. Help the resident out of the bath or shower. The drying area should be warm and comfortable. Cover the resident with a towel or a robe whenever possible. Make sure the resident dries off completely before getting dressed. And sixth, help the resident get dressed using the clothes you laid out at the beginning of the bathing process. To make it easier for the resident to get dressed, the clothes should be in the order that they will be put on. For example, undergarments are first and shoes are last. Using these simple steps when bathing your residents will make bathing safe and easy. These steps will also help residents stay calm and comfortable. Remember, residents are adults and deserve your respect. They may feel embarrassed or shy in front of you. You should do everything you can to make the bathing process easy and comfortable for them.
Okay. So I stop here.
Miss Fisher is
Okay, so after seeing these videos, can you share one learning point each from there? Maybe start from Angel. What did you learn from this video? One thing.
One,
What did you learn from the video?
we need to respect the patient, and we need to ask if the water is comfortable.
Correct. Okay, maybe Jen,
The ensure safety the patient.
safety. For example,
For
like
example, the bathing time, we need to communicate the patient if the floor is dry.
it means you need to pay attention to the patient all the time. Okay, correct. Yeah, there.
As Angel say is respect. Then particular one, communicate with the patient while doing the bathing for them.
Okay, correct. Thank you. So we are going to move on next for the quiz. So I got 3 questions of quiz each. So it means you will get 1 each. So maybe first one, who want to volunteer?
We need to give question or you need to ask.
I give you the question there and then you answer. I have 3.
So we guess the question, is it?
No. I show you the question. Who want to volunteer first to answer?
Okay lang nila.
Okay. So, okay lah. You're lucky, very easy one. You choose true or false. The top clothes of the resident must undress at bedside.
No, we undress to the toilet.
Okay, correct. So next,
Okay.
okay, okay. What are the 3 C of safe bathing?
Okay, collect, concentrate, and communicate.
Very good. Okay, maybe Angel, the last one. Okay, you choose the correct statement below. So, okay, you must shower the resident at least 5 to 10 minutes, true or false?
True.
Okay, it is not important to check the skin fold, true or false? What?
False.
Skin fold need to check or not?
We need to check.
Then false, right? Okay, and then the water temperature must check during shower time only, true or false?
True.
The temperature check shower time only or before shower
Before.
time, right? So it falls. Before shower you must check. And then the wheels of the commode must all be locked, true or false?
True.
True. Okay. You can leave the patient and attendant if the patient is securely positioned on the commode, true or false?
False.
Okay, good. So you have the true correct answer A and D, okay? Okay. So thank you for your time. Is there any question? No. Okay. Thank you for your attention. Okay.